Every Wednesday, we'll focus on a range of motion or an agility flexibility exercise that matches your child's stage in life. It's important to perform this activity for 7 days in order to obtain the maximal benefit from this exercise. Sometimes your baby's mood can alter your findings, so by doing this every day, by the end of the week, you should be able to determine if there's a true deficit or not. In short, range of motion is the amount of motion that a particular joint can move freely in. Different joints can move in various planes, and in each plane, the joint can move in a certain degree, which has been defined in the literature and is recorded in set norms. So we will be specifically working in those norms. Now, active range of motion is the movement patterns that we perform actively or by the use of our voluntary muscles. For example, it is the motion performed when someone says, "Can you raise your hand overhead?" Now, passive range of motion is the movement performed when the patient is relaxed and manually moved by the examiner. This is the type of motion you will be performing on your baby initially. Now, there are other types of range of motion, but for the purpose of what we're looking for, these two groups of motions will provide us with crucial information about the joint we are testing. So, in addition, flexibility is a main component and directly correlates to how much motion is available at each joint. A certain amount of flexibility is needed in order to perform daily gross motor milestones. So for instance, the extension or straightening of one's leg is directly correlated to how flexible a person's hamstrings are. And this varies on age, gender, genetics, and past injuries. So for example, one of the most common range of motion deficits seen in the clinic is the lack of full range of motion of the neck for our baby. This will be noted by the baby only turning his or her head to one side and not so much to the other side. There could be many reasons for this, such as a tight cervical and neck musculature, poor hearing, visual impairment, a vestibular issue, etc. But by testing the range of motion, this should give you more insight into the overall problem, and then you can relay this information to the medical professional, and they can help you solve and get to the underlying issue. Many times during the baby's first well checks, being concerned parents, we have a large list of things that we need to run by the medical professional before the end of the session. This goes the same way for the medical provider. They're only given a certain amount of time to do a general assessment of the child, and often my own experiences, my children's range of motion was not even checked. So by doing some of the testing or exercises, this will at least give you some information to add to that long checklist we often find ourselves prepared with to ensure that one area does not get inadvertently neglected. Now, I hope you find these exercises useful and can follow the progression easily. Remember to perform these exercises slowly and be gentle. We never want to cause pain, so if your child appears to be in distress or is extremely uncomfortable, just stop the activity and talk to a medical professional. Make sure to read the disclaimer prior to performing any of the exercises to ensure your child meets the basic criteria. And remember that a healthy baby is peace of mind.